Recently, we heard the tragic news of the 42-year-old actor and model Shefali Jariwala, who passed away in her sleep and apparently due to a cardiac arrest. So she was a healthy person and quite physically active, going to gym, and she had no, immediate concerns that could have caused this. So definitely, this is a tragic incident for all of us, and my heartfelt felt condolences to her family members, friends, and fans. However, if we look at the possible causes for someone so young, and one of the things that comes to our mind is she had epilepsy, which she had mentioned in few of her interviews since the age of 15, and we know that there is a condition called SUDEP, which is sudden, unexpected, unexplained death in epilepsy patients, and so that is one of the conditions to keep in mind in a person who has epilepsy, and which because it can result in sudden, unexpected, unexplained death. So what is SUDEP? So SUDEP is, as I mentioned, that it is a cause of unexplained death in people with epilepsy, and it is heartening to note that it is not common. It occurs only in about 1 out of 1,000 epilepsy patients. However, the incidence may be higher in people who have refractory or repeated seizures. There it could go up to even 1 in 150 people. So what exactly happens, or what are the reasons by which an epilepsy patient may suddenly die? So if a person is sleeping and a seizure occurs, uh, about four of the things could happen that can cause sudden death. One is post-ictal respiratory depression. So generally after a seizure, the respiration or breathing may be suppressed or depressed, and that could lead to hypoxia or less oxygen, and that could be one of the causes. Second is the seizures can lead to autonomic nervous system dysfunction, and which this nervous system controls the heart rate, blood pressure, and breathing also, and so as a result these important functions may be affected. The third is seizure itself can give rise to cardiac arrhythmias like ventricular arrhythmias, which can lead to cardiac arrest. And fourthly, if a person is lying down prone, that is face down position, and then a seizure occurs, then it can result in choking and also respiratory depression and cardiac arrest. So these are some of the conditions, but we have to note that always, it's a diagnosis of exclusion. So in a post-mortem, other possible causes of cardiac arrest should be excluded, and only then one can make a diagnosis of SUDEP. So finally, this brings us to the topic, how we can prevent this. So number one is that any person with epilepsy should continue taking anti-seizure medication, because that is the best method to control or prevent further seizures, and they should not be skipped. And second is, if there is a person who is witnessing a person with seizure, then the person should be turned to the side so that the salivary secretions or mouth secretions do not cause choking. And when the person is unconscious, don't give anything in mouth, because again any water or food can result in choking. So these are some of the things that can be done to minimize the risk of SUDEP and any complication in epilepsy patients.